Thank you, Mr. Chairman. The COVID outbreak and subsequent economic fallout is a national and international crisis that is certainly deserving of a dedicated congressional response and oversight. As the President said, we're at war with an invisible enemy, and we must all work together to ensure as many Americans as possible are healthy, safe, and able to provide for their families. Unfortunately, instead of acknowledging that a nonpartisan human health and economic crisis deserves a nonpartisan congressional response, we find ourselves in a committee proceeding eerily similar to those of the House majority forced on the country to endure months in 2019. This briefing was constructed with absolutely no input from the ranking member and minority whip, Mr. Scalise. Republicans were not allowed to invite a witness, and we were given so little notice that some of us who believe we should be in D.C. for a meeting or the committee proceedings did not even have time to get there. That's my comment. My question is, for Dr. Gottlieb or Dr. McClellan, either one that wants to try it, I think the key to all of this is perspective. And let me just briefly say this. In Missouri, I was on a conference call the other day with the Missouri Hospital Association. We have 4 times as many people who have died this year with flu and pneumonia than we have COVID-19. The mortician in my area here was telling me that he's burying more people due to suicide than he is COVID-19 in our 2 largest counties combined. My caseworker who does Veterans Affairs says she's no longer a caseworker, she now is a counselor. She's talking to these veterans off the cliff every day because they no longer have a support network by going to the coffee shop or they can't go walk in the malls. The study is being done by what's happened in New York. 80% of the brain surgeries were postponed. And there's a study back a few years ago that showed for every 1% increase in unemployment, 37,000 people died due to heart attacks, suicides, homicides, and drug overdoses. So, gentlemen, you put yourself in my shoes. I understand your patient concern for folks and in the COVID-19 situation, and I don't minimize that risk at all. It's there. But the problem is the rest of society has certainly got a health problem as well. When you have people not getting cancer treatments, as you mentioned a while ago, Dr. Gottlieb, brain surgery is not being done. You have mental health, child abuse is up, alcoholism is up. As a policymaker, I have to make a decision. I have to have perspective again on this. If you're in my shoes, how would you make that decision?
This is Dr. McClellan. To start at least, I've talked to a number of states and governors who are in this similar kind of position. It would be great if we had more testing capacity months ago. I don't think that's enough by itself. It's not a whole strategy for containment. It also requires changes in the way that businesses behave, changes in the way that people behave. All of these are parts of an effective response. So having more testing as you go forward with reopening is really critical. Do I wish we had more capacity in place now? Certainly, but there are other estimates out there, somewhat less than the 6 million per week number that we've talked about so far, that could be part of a comprehensive approach.
Well, my question is this. You're asking me...
I think your time is out, Dr. McClellan.
That's my question. How do you make that decision?
Mr. Chairman, could I answer that question?
I'm sorry. I think the time has expired.